Also keeping the closest of eyes on Hurricane Harvey, county leaders along with the emergency staff at Harris County's Emergency Operations Center.
But also, it's a big concern for leaders at the Texas Medical Center. It was badly flooded during Tropical Storm Allison. Adam Bennett live at TransStar with how they are preparing. Hey, Adam.
Hey, Jason and Sherman. Well, here at TransStar, several departments keeping a close eye on Harvey as it moves its way toward the Texas coast. You can see the monitor behind me. It is a slow-moving system that's predicted to sit right on top of us and dump rain for days. Now, of course, those are very similar conditions to what we saw 16 years ago when Tropical Storm Allison devastated our city. Medical Center, no exception. Around 10 million gallons of floodwater poured into the McGovern Medical School at UT Health. $87 million in damage total there. Now, since then, they have shelled out more than $20 million to protect themselves 3 different ways against future flooding. First, an outer berm and pumps. Secondly, a hydrostatic wall that provides flood protection a foot above the 500-year floodplain. And finally, 23 flood doors that can be closed just by one person in less than 5 minutes. Several different departments there then keep a close eye on the Rice TMC flood alert system, and when it hits level orange, they close those doors.
Our lowest lying levels within the building, we close those first, and then we close the last of our flood doors only if and when necessary, because these are doors that could potentially impact traffic in and out of our buildings.
And staff says they still have places to enter and exit the building, and also they spread the word through signs and also electronic communication. By the way, they test those doors every year just before hurricane season starts, just to make sure everything works. Now, as for the staff at the hospital, the CEO of UT Physicians tells me they are ready, they are prepared. He says that they make sure they have everything ready in case of a power failure. But he says if you're a patient and you have medication, make sure you have a week's worth of supplies. And he says if you don't, if you need to refill, do that today. Do not wait until tomorrow or Saturday. Jason and Sherman.
All right, good advice. And if you've seen those doors, they are really impressive.
Yeah.
Thank you, Adam.